Pneumonia, is it deadly or treatable? Have you ever had a cough that just wouldn't go away? Or known someone who had trouble breathing after a cold or the flu? It might be more serious than you think. Today we're talking about pneumonia, a lung infection that can strike anyone, at any age. What is pneumonia? It causes the air sacs in your lungs, also called alveoli, to fill with fluid or pus. This makes it hard to breathe, and if left untreated, it can be life-threatening. Pneumonia isn't a single disease. It's a lung condition that can be caused by a variety of germs, including bacteria, viruses, and even fungi. Depending on the cause, pneumonia can range from mild to severe, and some types can be highly contagious. There are several types of pneumonia, each with unique features and levels of risk. Let's break them down one by one. Bacterial pneumonia is caused by bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and Klebsiella pneumoniae. It can be severe, especially in the elderly or people with chronic conditions. While not usually contagious, the bacteria can spread through droplets and infect vulnerable and immunocompromised people. The good news? It's often treatable with antibiotics, but without treatment, it can lead to complications. Viral pneumonia is caused by viruses like influenza, RSV, COVID-19, or other respiratory viruses. This type of pneumonia is highly contagious and spreads through coughing, sneezing, or even talking. It often starts like a cold or flu, but can worsen quickly. It can range from mild to life-threatening, especially in babies, older adults, or people with weak immune systems. Fungal pneumonia is a rare type, usually affects people with weakened immune systems, such as cancer patients or transplant recipients. Often caused by fungi like Pneumocystis jirovecii, formerly Pneumocystis carinii, Aspergillus species, or Histoplasma. Though not contagious, it can become life-threatening if left untreated. It typically progresses gradually and often requires targeted antifungal therapy for effective treatment. Understanding pneumonia starts with knowing whether it's community or hospital-acquired. A community-acquired pneumonia develops outside of healthcare settings, while hospital-acquired pneumonia occurs 48 hours after being admitted to a hospital. This distinction helps in identifying the cause and determining the appropriate treatment. Community-acquired pneumonia, or CAP, is the most common form and occurs outside of hospitals. It often affects children and older adults, and symptoms develop gradually over several days. So, is walking pneumonia the same thing? Not exactly. Walking pneumonia is a milder form of CAP, where someone may still feel well enough to stay active. It's usually caused by atypical bacteria like Mycoplasma pneumoniae, Chlamydophila pneumoniae, or Legionella pneumophila. Hospital-acquired pneumonia develops after hospital admission and wasn't present when the patient was admitted. It is often more severe due to the presence of antibiotic-resistant bacteria. Ventilator-associated pneumonia, a subtype of hospital-acquired pneumonia. This occurs 48 hours or more after a person has been intubated and on a ventilator. Aspiration pneumonia occurs when food, liquid, vomit, or saliva is accidentally inhaled into the lungs. It can develop either in the community or during a hospital stay, so it's classified as community-acquired or hospital-acquired depending on where it occurs. Unlike other types, it's not linked to a specific germ, but rather to the way the material enters the lungs. Recognizing the symptoms of pneumonia early is crucial for effective treatment and prevention. Symptoms can start suddenly or build up slowly. Watch for fever and chills, a persistent cough with phlegm or pus, shortness of breath, chest pain when breathing or coughing, fatigue or weakness, and blue lips or nails, which is a sign of low oxygen. In babies, look out for fast breathing or poor feeding, lethargy or irritability. And in older adults, confusion or a sudden change in behavior can be key indicators. The good news? Pneumonia is often preventable. For children and babies, make sure to get vaccinated for pneumococcus and Haemophilus influenzae type B, or Hib. Stay up to date on all childhood immunizations when possible, breastfeed to boost immunity, and avoid secondhand smoke. For adults, get pneumonia and flu vaccines, especially if you're over 65, a smoker, or have chronic health conditions. Avoid close contact with people who are sick during flu season. Quit smoking as it damages lung defenses. Most of all, always practice good hand hygiene. Don't wait. See a doctor right away if you or someone you care for has trouble breathing, a high fever that doesn't improve, chest pain when breathing, a worsening cough or blue lips, fingers, or mental confusion. These could be signs that the pneumonia is serious and needs immediate care. Pneumonia is preventable and treatable. By recognizing the early signs of pneumonia and taking preventive measures such as vaccination and proper hygiene, you can significantly reduce the risk of serious complications. If you found this video helpful, don't forget to subscribe for more health content simplified just for you. Stay healthy, stay informed, and we'll see you in the next video.